cool stuff that we need to look for and look at. So best way to do is, again, we try to orient ourselves to the best position to orient ourselves with. So usually when we do this, it's nice to have them sitting so that you can kind of be above and around. Unless we're working on the back, then we'll have them standing. All right, but a good place to orient ourselves with first is our suprasternal notch, which, if you want to see, is right here. Okay, so it's basically where the clavicles come in and meet with the manubrium of the chest plate or breastplate right here. Okay, so that's that notch right here. Okay, so that's our first ID spot. If you ever want to tell someone to get away from you and you want to push on something, push on that. It's very uncomfortable to keep pushing on that, really. All right, on that one, okay? So that's our first orienting spot right there, so suprasternal notch. Again, pretty much a fail if you can't get that one. Okay, so that. Okay, then we want to look at the sternoclavicular joint, okay? And so it really does tell itself where it's at in its name. So that's going to be this two joints right here. Very, very hard to move this, okay? So it's going to be really tight. And so on either side of the notch, okay, is going to be that sternoclavicular joint, okay? So right there, either way, okay? And then basically what we do is we want to just work our way out the clavicle. Okay, so this is the clavicle. It's the very big bony process that we see right here, and we can just work our way out to the shoulder itself. Okay, and what we see is it's very prominent, and then it dips away, disappears on us right here, and then it comes back when we get to the tip of the shoulder, and that's going to be our acromioclavicular joint, which is right here on top of it. Okay, so that's going to be that acromioclavicular joint. Just making sure I got that. Okay, all right, now from the acromioclavicular joint, if we take our fingers and we just drop straight down off of the acromioclavicular joint, we'll find this soft little tissue point right here. Okay, coracoid process is right here. So if we push on that, all right, we can get the coracoid process, all right, which is, again, just a little bone that we're going to feel right here. Okay, so I can feel it pretty good on him. Yeah, it hurts a little bit. That's why I don't want to push too hard, all right, because you could really cause some pain right there. Okay, on that one. So that's that coracoid process. Okay, got acromioclavicular. All right, now come back up to our AC joint, and then what we're on is we've got the clavicle that comes right here into the acromion, which is right on the back side of that AC joint. Okay, so we just come backwards a little, posterior towards us. All right, we'll be on that acromion right here. Okay, all right. Sure, I got that. Okay, all right. Now, if we're coming out here, the greater tuberosity is actually the humeral head. All right, and so we want to feel that greater tuberosity. So we want to come off of the shoulder. So we'll see the lateral border of the shoulder right here. And then if we come just a little bit anterior, okay, right here, all right, I can kind of roll that biceps tendon. And then right in front of that is our greater tuberosity. So right here, okay, is where that greater tuberosity is going to lie. Okay, so again, if you want to go coracoid process, which is right here, it's kind of in line with that coracoid process. It's just a little bit more lateral from that. Okay. And then our bicipital groove is right there. We find that greater tuberosity, and then we come just a little bit posterior to that, and we're in that bicipital groove. And that'll slide right here. I know it's hard to see in a shirt, but we'll get everybody touching on it in a second. You'll be able to feel it. Okay. All right. Stand up, turn around so everybody can see your back. All right. So posteriorly, what we've got is spine of the scapula, medial border, inferior angle, and lateral border. Okay, so if we're coming back up here to our acromion, right, our spine of the scapula just runs basically from the acromion where it starts back to the middle point of the midline. All right, so here's the spine right here. So it just runs right back through here. Okay, our medial border, okay, remember we go by midline. All right, so our medial border is going to be on the inside border of the scapula. So you can kind of just palpate it all the way down. Okay, and I can get that to push out. If I want it to come out a little bit more, if I take his hand and I put it behind his back like that, you see how it kind of pops out now? Okay, and I can get that medial border really good from there. Okay, it's a really good stretch. You got a baseball player, you pull on that, it just comes right on out like that. It feels fantastic for him, I'm telling you right now. So that's a good one. So, and you can see it kind of starts up here, and then it works its way all the way down. Our inferior angle is right down here. Okay, so where the scapula kind of bends right here. So it'll come right back down through here. So here's that inferior angle. Drop your shoulder back down. All right, and then our lateral border is going to be on this outside part right here. So you'll have to palpate that a little bit more because you might have some musculature back here. You're dealing with the lats when you're palpating that. And so this is going to be that lateral border right here. Okay, and it runs back up here. Okay, so if I take my hand, I can just, my thumb makes that lateral border. Medial border, inferior angle, spine. Everybody got those? Pretty good right there. Okay. All right, so that's the bony. So why don't we get together? Let's do the bony before we move into soft tissue.